Welcome to the press conference on the measures set out in the policy address 2022 in relation to the measures about the health and labor and welfare. With us, the officials are Professor Lo Chong-mao, Secretary for Health, Mr. Chris Sun, Secretary for Labor and Wealth, and we also have the Mr. Thomas Chen, Permanent Secretary for Health. Professor Lo and Mr. Sun will talk about the work under their respective portfolios. We will first hear from Professor Lo. Members of the public, friends of the media, good afternoon. I will now outline the health policy measures set out in the policy address 2022. We want to create a city that is healthy and vibrant. We want to achieve a goal that is more on prevention and less about treatment. We want to have more facilities and to cut down waiting time. With an aging population, chronic illnesses are becoming more common. The burden on the public healthcare system is becoming increasingly heavy. The wait list is getting longer for specialist hospital services. With COVID, we've seen how an over-reliance on the public hospitals is creating problems. That's why we need to do more on the side of prevention through primary health care. To ensure public health, the new term government has proposed 8 areas of work, and I will report on these areas. First, in terms of the primary health care, we will launch the primary health care blueprint this year. We will have district health centers as nodes where we will have a collaboration with the private healthcare workers and have this Family Doctor for All initiative. This will coordinate different healthcare professionals to provide comprehensive, sustainable services that are also patient-based at the district level rather than in hospitals. For the government, it will set up a primary healthcare authority that is tasked with managing the primary healthcare services provided by public and private healthcare professionals. There will also be mechanisms in place to ensure the quality of services. In terms of governance, there will also be a strategic purchasing office coordinating the services provided through public and private collaboration. The third point is that we will establish a steering committee on healthcare facilities planning and development. We are trying to rework our hardware, sites, for example, and facilities to take forward the relevant development and redevelopment projects. The point is to have more facilities to provide healthcare services. By the end of 2020, we will have district health centers or district health expresses, that is, facilities that are smaller in scale and transitional in nature. We will be able to cover every district in Hong Kong this year. When it comes to primary health care, a key area is the co-management of chronic illnesses. We will launch a pilot scheme. For the scheme, this will be done through the district health centers. We've picked diabetes and hypertension to start with. We will identify these patients when they visit their family doctors or visit our allied healthcare professionals. There will be screening. The screening and treatment fees will be covered by the government, up to 50% of the fees, through lifestyle changes and intervention through medication and also cross-disciplinary guidance. People will be able to better manage their health conditions to prevent complications. that is how we will be able to take pressure off the public healthcare system. Over the long term, we will also be able to establish long-term ties between the patient and healthcare providers. One of our goals is to have the same family doctor for each patient instead of having the patient visiting different doctors with treatment proposals that may not work best for the patient. For each citizen, there will be a certain amount of money. It will take time to look into the relevant proposals. The government will announce the proposals. In next year, there will be a 3-year pilot scheme regarding chronic disease co-care, and that covers diabetes and hypertension. In terms of medical vouchers or healthcare vouchers, there will be enhancement measures for elderly care vouchers. They make up roughly 18% of all the primary healthcare resources. Under the framework of our public healthcare proposal, we aim to further enhance the use of elderly healthcare vouchers so that our seniors spend the vouchers on primary healthcare to prevent diseases and manage their health. This enhancement proposal includes allowing the shared use of vouchers between spouses. The second point in the plan is to extend the coverage of the vouchers. This will cover the recognized medical services such as psychologists, speech therapists, and other specialists. So after a professional assessment, let's say someone needs a hearing aid, the medical or the healthcare voucher can be spent on such equipment. There will also be a 3-year pilot scheme so that the healthcare voucher will be increased by $500 to $2,500. But this comes with a condition. Seniors will have to spend $1,000 of the healthcare vouchers on primary healthcare items before the additional vouchers are deposited added to the balance so that the vouchers can be spent on other things. For primary healthcare, it also involves the participation of Chinese medicine practitioners, so that Chinese medicine will play a bigger role in primary healthcare. There will be collaboration with Chinese medicine services. We will also make good use of this cross-sectoral services. So in that regard, physiotherapists and occupational therapists will be able to provide services without referral. For dental services, the government appreciates the keen demand for dental services. And we will set up a working group on dental services to conduct a full review on the dental services made available. For public hospital services, the Health Bureau and the Hospital Authority will make use of technology and will also roll out measures involving different disciplines to improve the patient experience and improve the efficiency so that our services are delivered with a patient-centered basis. We will take a multi-pronged approach to shorten the waiting time. For medical cases, and specialist cases, we want to cut down the waiting time by 20%. There will be a variety of measures to achieve this goal. We will also make use of technology through the HA-Go mobile app and other tech platforms. We will promote the use of telehealth services. During COVID-19, teleconsultations have worked well, and we want to take this opportunity to promote the use of such services so that more patients can access the services provided by the hospital authority at their home. The hospital authority will also launch drug delivery services so that after a consultation, the patients won't have to wait for too long before they can have their medication delivered at their doorstep.
In addition, for patients requiring treatment across different specialties, the hospital authority will set up the integrated neuroscience centers and cardiovascular diseases centers so that it will take the form of a multidisciplinary professional collaboration to provide one-stop service to the patients. In addition, the hospital authority will set up the Poison Control Center, under which there will be an integrated Chinese and Western medicine treatment safety center and a drug abuse early warning system so that we can enhance our control in relation to poisoning as well as the treatment of patients. The hospital authority will also act in accordance with the national standards as well as the first set of uncommon diseases at the national level to further enhance and expand our database. And we are going to collaborate with the national network as well as the Hong Kong Genome Center so that we can enhance our research capability and then provide more support to the patients. Well, in terms of the quality of our public hospitals, in the year 2023-2024, we're going to resume our accreditation-related work at 2 public hospitals. It is important for quality assurance. We're also going to press ahead with the implementation of the first 10-year hospital development plan, providing 4,600 more beds and 80 more operating theaters in the next 5 years. Under the second 10-year plan, we are going to examine other factors like the hospital cluster for the northern metropolis. We are going to promote the e-health. We will explore the proposal to mandate the uploading of more types of health records by legislation so that it will become a key infrastructure integrating public and private healthcare systems. It will become an important element of our primary healthcare. Now come to healthcare manpower. We will explore the idea of requiring qualified healthcare professionals to serve in public healthcare institutions for a specified period of time. One example being non-local doctors. They come to Hong Kong and they have to serve in the public healthcare system for a certain period of time, so as to make sure that our public healthcare system in the future will have a steady supply of manpower. On the other hand, in the light of the experience of amending the Medical Professionals Registration Ordinance last year, we want to, by way of legislation, admit qualified non-locally trained dentists and nurses so that more non-locally trained healthcare professionals can come to Hong Kong and provide service to the Hong Kong citizens. Chinese medicine has become an important part of our healthcare system. We are going to enhance the relevant unit under the Bureau. And there will be the post of the Commissioner for Chinese Medicine Development. And then we can go all out to promote Chinese medicine. We'll be formulating a blueprint on development of Chinese medicine. We increase the government-subsidized Chinese medicine outpatient service quotas from 600 to 800,000. We'll regularize and expand integrated Chinese Western medicine services. And we are going to increase the types of diseases that will be covered by the integrated model. And then there will be more hospitals. There will be more hospitals there will be more hospitals to be taking part, and we are going to deepen the collaboration in Chinese medicine between Hong Kong and mainland as well as the Greater Bay Area. And then for our Chinese medicine hospital and the government Chinese medicine testing institution,
from 2025, we will be able to commence the services in phases. This is a major project in the Chinese medicine initiatives of the government. In terms of mental health, this is a key part of health. The government will take into account the needs of different groups and enhance mental health services in different ways. And there will be a pilot public-private partnership scheme for psychiatric services at schools. And we will strengthen the multidisciplinary student mental health support scheme so that for students in need, we can identify the conditions early and provide the support necessary. In terms of mental health support in the community, there will be a mental health support hotline, so the support and referral services can be provided. Now, for ethnic minority groups, we will take into account their needs. We will work with them and have, on a trial basis, emotional support and counseling services to be made available to them. In terms of tobacco control, through the concerted efforts of the government and various sectors, for those aged 15 in Hong Kong, the percentage of smokers was 20% in the 1980s. Now the number is at 9.5%, at historic low. In this area, in the towards 2025 strategy and action plan to prevent and control NCD in Hong Kong, the target is to have the smokers rate from 9.5% all the way down to 7.8% by 2025.
As to our cooperation with the mainland on medical issues, we're going to make reference to the registration approvals by the NMPA, National Medical Products Administration, and other drug regulatory authorities to allow more eligible pharmaceutical products to be registered in Hong Kong and sold in Hong Kong in the light of the safety, efficacy, and quality being sort of assured. On the 1st of November, it is going to take place. And then in relation to our idea of allowing the medical devices and the devices to be allowed, we would like to cover more types, and we would like to allow more patients who are on the mainland to be able to make use of pharmaceutical products already on sale in the market of Hong Kong. And then we have the construction plan for the Chinese Medicine Highlands in the GBA. We are going to foster our collaboration in Chinese medicine with the mainland so as to provide more opportunities. Finally, I'm going to talk about it, making use of the last slide. In fact, it was a very important topic covered in the final chapter of the policy address of the CE. We've been hard hit by the epidemic, and our healthcare system has met with a lot of challenges as well. We have put forward a series of precise and anti-epidemic measures based on risk management. I'm sure you're familiar with the 5 principles in our anti-epidemic work. Well, in fact, the World Health Organization has just announced that the COVID-19 is still with us. It is still a public health care emergency that requires our concern. Well, in fact, the CE has time and again repeated that we have to balance the risk of the epidemic as well as the need to develop our economy. We'd like to strike a balance between the two, and we hope that we should and we could create the greatest room for people's livelihood and economic activities. We won't be going back, we won't be backtracking, and we would like to achieve the greatest impacts with the lowest costs. On this note, I would like to end my briefing. Thank you. Next, Mr. Sun, the Secretary for Labor and Welfare. Thank you. Friends of the media, citizens, I would like to talk about labor and welfare initiatives. There are quite a few slides, but then I will just give you the highlights, probably that can allow more time for you to ask questions. It so happens that I've got 8 major areas, like Professor Low in his briefing. First of all, targeted poverty alleviation. I want to take this opportunity to talk about the Strive and Rise program, which has attracted a lot of attention. Well, in terms of recruiting mentors and students, that work has completed. We are going to kickstart the campaign. In terms of the response, it has been much better than expected. It is believed that towards the end of October, we are going to host the launching ceremony. We hope that in this way we can be more targeted and we can deploy resources to help the targeted sectors in poverty alleviation. Next, protecting children. Again, it is close to the heart of the community. There are 2 major points here. First of all, we're going to introduce a bill into the LegCo in relation to the mandatory reporting of child abuse cases. And second, in the light of the suggestions of the Commission, we would like to improve residential childcare services. And then in terms of visits, inspections, and law enforcement, we are going to enhance our efforts. And then for the carers of elderly persons and of persons with disabilities, we want to enhance our support for the carers. A number of new measures have been suggested to give support to the carers. I would like to give you a few highlights. First of all, we are going to regularize what we have already got under the Community Care Fund, namely the carer allowances. Other than regularizing the allowance, we are going to increase the amount of the allowances. For the elderly, for the people with disabilities, the monthly subsidy will be, instead of $2,400, it will become $3,000 a month. For the 2 allowances for carers of elderly persons and carers of PWDs and who are from the low-income group, we believe that 10,000 carers will benefit. And then we want to set up a one-stop information gateway. We will be having a designated hotline for carers. There will be more respite service places. And we're going to have a territory-wide publicity campaign so as to raise public awareness of the needs of the carers for persons with disabilities. Again, there will be a number of initiatives to provide more support to PWDs. On the slide, I have already given you the enhancements. I'm not going to elaborate on them. Please refer to the information we've provided. Caring for the elderly. Now, Hong Kong is an aging society. As to how we are going to take proper care of our elderly population, it is an imminent issue and has attracted the attention of all. There are 2 points here. First of all, as far as our government policy is concerned, we would like to support aging in place, and institutional care should act as a backup. For us to facilitate aging in place, there are a few important initiatives proposed in the policy address. First of all, for the pilot scheme on community care service voucher for the elderly, we are going to regularize the scheme. There are at present 8,000 of them. They will be gradually increased to 12,000 100,000. There is an increase of 50% in the year 2025-2026, so it will be a significant increase. In addition, in the coming 5 years, we are going to have 16 more neighborhood elderly centers. In this way, the elderly can get support in the community. And it will also cover more areas like retirement planning and the promotion of children technology. Some other people are concerned that upon discharge from a hospital, elderly patients may have to go back to hospitals soon. Therefore, we are increasing the number of places under the Integrated Discharge Support Program for elderly patients. We believe that we can bring the level up to 45,000 from the current 33,000. And then the number of beneficiaries who can be referred to home support services will increase from about 9,000 to 11,000. Daycare service places for the elderly will also be increased. Residential care home services are also of concern to you. Well, let me first of all talk about the hardware. There is the number of residential care places. And then, of course, another important point will be the manpower issue. First of all, the increase of the number of care places. We're quite sure that by the end of 2027, 2,900 more subsidized residential care places will be provided. Or rather, 6,200 more will be provided by end of 2027, 2,600 of which will commence service next year, so an increase of almost 20%. In addition, in the policy address this year, the Development Bureau and our Bureau will join hands to make proposals to the CE so as to find ways to encourage the developers to provide elderly service facilities in their private development projects to meet the needs of our aging population. Manpower will adopt a multi-pronged approach. First of all, there is the need to develop a career path or a ladder. We have to employ a large number of care workers. Experience tells us that irrespective of our efforts, it is difficult to get sufficient care workers locally. We need a special scheme so that all the RCHs for the elderly and for PWDs, they can have care workers imported. And we'll try to relax the ratio of care workers to be imported. We want to streamline the vetting procedures for the applications. More details will be announced later on. Well, other than care workers, we need nurses, in particular enrolled nurses. For many years, home operators have been telling us that they found it difficult to fill all the nursing posts. Therefore, we're going to significantly increase the number of subsidized places for training. In other words, the SWD will subsidize $200,000 for the nurse students. But then, of course, there is a condition. They have to work in the welfare sector for a certain period of time. We are going to have 228 more such places. In other words, for the next 5 years, there will be a total of 428 enrolled nurses who, upon graduation, will work in the welfare sector, and they have to undertake to work for 3 years under the scheme. And they will be arranged to work in such homes. In other words, in the next 5 years, for those taking such a subsidized training program, there will be 1,700 more nurses to be trained, and that can meet the needs of the sector. We'll also review the skill and qualification requirements of the staff of RCHs with a view to establishing professional standards and a career progression path. So it's a matter of people taking up positions between nurse and health workers. So I know that, in fact, there are certain local youths who are willing to join the scheme. But to make it more attractive to them, we need to review our professional standards as well as the career path so that they have sort of promotion in sight.
Turning to Social Security allowance schemes, in September we merged the normal and higher old age living allowances. In terms of the new round of manpower projection, we will proceed with the new round of exercise. We will also compress the time frame from 10 to 5 years. That is the projection period we're talking about. And then in terms of retraining, we will look into ways to increase the daily rate of allowance and providing allowance for half-day courses. Now, something that has worked well is the Greater Bay Area Youth Employment Scheme. We will try to regularize it from 2023 onwards. For the Labor Department, there will be more posts, more people to support ethnic minorities in a job hunt. Now, turning to the minimum wage. This is something of interest to many people in the community. We will ask the Statutory Minimum Wage Commission to look into the review mechanism, including the cycle, and how to proceed with the review more efficiently. There will be a report to be submitted to the Chief Executive. And the protection of wages upon insolvency fund, we will further enhance the arrangements. And as the government has pledged from 2025 onward, we will scrap the offsetting mechanism under the Mandatory Provident Fund system. We will also review the employment ordinance. Now, turning to occupational safety and health, there are 2 points I would like to make. First, the LegCo is looking at the bill to raise the maximum penalties for OSH offenses. We will try to wrap up the examination to get it passed and implement the penalties. We will also focus on worksite safety, especially concerning truss-out scaffolding works. Next year, we will also look into ways to better protect workers, especially against heat stroke risks. During summer, we will revise the guidelines to protect employees from heat strokes. I will stop here, and I will be happy to take questions. Thank you, Mr. Sun. We will now open the floor to questions. Please use the microphone we'll give you, and before putting your questions, please identify your media outlets. Please limit yourself to 2 questions and keep your questions succinct. We'll start with the lady in white over here. I have 2 questions. Just then, the court has handed down the judgment regarding the appeal, the judicial review against the JEB exemption case the government has lost. Will the government amend the law, such as inserting a clause in Cap 599L, giving the Secretary for Health such a power? And for the Primary Healthcare Authority, can we have more details about the setup? There is talk that the hospital authority will not be providing services directly. Which government department will be providing the services, and what's the budget like? I'm aware that the court has just handed down the judgment, but as you can see, I have been walking you through the policy address measures. I haven't had a chance to find out more about the judgment. I will look into the judgment along with the Department of Justice, and we will make an announcement. For the Health Bureau, we have the responsibility to protect the health of the people of Hong Kong, the 7 million people of Hong Kong. And this is a very important duty we are undertaking in these COVID times. Now, turning to the Primary Healthcare Authority. The authority will coordinate the services provided by public and private healthcare providers, that is, those provided under the Department of Health, the Hospital Authority, and those provided by the private sector and NGOs. This Primary Healthcare Authority will be manned by staff from the HA as well as the Department of Health. In 2024, we will set up an authority. The authority will have statutory powers to provide supervision and provide primary healthcare services, and they will also have a purchasing office in terms of procuring private services from private providers. It will also be able to lay down guidelines in terms of the workflow, and it will also be able to keep an eye on the services available from the private sector. The authority will also take over the training for the healthcare professionals. Next question. As for further details, we're still looking into the details and we will provide them later. Over there in the fourth row, the lady at the far end.
From Bloomberg, 2 questions for Dr. Lo. Firstly, we are seeing more discussions about the remaining COVID restrictions, such as compulsory testing orders and mask wearing, and number of people limit in different venues. And we want to ask, in the long term, what kind of rules will stay more like permanently, and what are the rules that will be considered to gradually phase out? And then we also want to ask about the exemptions for people coming to the financial summit in November. What kind of rules will be considered to be removed for them? Thank you.
Professor Lo, please.
Okay, the government strategy towards anti-COVID is very clear, as explained by the Chief Executive. We are balancing the risks of the COVID pandemic versus the economic requirement, the living of our citizens, as well as our financial activities. So in that sense, our direction is very clear. But we cannot state for sure the specific time point for particular measures, but be reassured that we are balancing the risk versus the benefit, and we will maximize our relaxation of these measures in return, but we have to make sure that the risk of the disease transmission is not exaggerated. So the direction is very clear, but we have to do it in an orderly manner and with due consideration of the possible the emergence of different subvariants in different parts of the world. Remember that the WHO, the World Health Organization, has recently declared that the COVID-19 is still an international public health measure of concern. So the pandemic is not over yet. And the United States has also extended its public health measure for COVID as an emergency public health measure. With regard to the financial summit, I think I'll ask the Permanent Secretary of the Health Bureau to explain the current decision and the planning.
Now, the Financial Summit is being organized by the Hong Kong Monetary Authority, and we have been working very closely with the Monetary Authority to facilitate the event to take place. The objective is to showcase that Hong Kong is reconnecting with the world, and we are facilitating these overseas financial visitors to visit Hong Kong for their business. Our overarching principle for considering the conditions or requirements for the event to take place is, on the one hand, we endeavor to facilitate the happening of the event as far as possible, the activities, and at the same time ensuring that the transmission risk remains manageable. So the measures that are to be imposed for the events will include the testing, which include the PCR and the rapid antigen test, and also there will be designated hotels and activities and also venues for particular events to take place. The purpose is to ensure that there is proper segregation of the participants with the public and necessary control measures being taken. As for the treatment of the confirmed case, we will adopt the same isolation arrangements as with other inbound visitors. But at the same time, we would also provide facilitation should there be appropriate arrangements, flight arrangements for leaving Hong Kong, but that would be subject to the arrangements of flights and also point-to-point transport. That is actually a practice that we have adopted previously for individual cases where, for instance, air crew which have been confirmed in Hong Kong but which require to be returned to their home countries for various reasons. Thank you.
好，我真係答咗兩條有關於衞生嘅。
Would have taken 2 questions about health. Any questions about labor and welfare? Over here in the 3rd row, the gentleman over there. I'm from Hong Kong Economic Times. For care homes, there's a relaxation about the importation of foreign workers. But from March to April, 3,000 imported workers have been allowed to come to Hong Kong. For the future relaxations of imported workers, how many imported workers will there be? Have you consulted the local sectors? How's their response? And for the allowances for carers, the money from, now this will be increased to $3,000 from $2,400. But people are worried that the threshold for application is too high. Will the threshold be lowered in the future? Thank you for your questions. From March to May this year, that was a one-off arrangement. We were in the 5th wave of the outbreak. And there was a major shortfall of carers at care homes. As long as there was a need, we granted the application. So 3,000 quotas were given. There was a 2-year limit. So in the next 2 years, we will be able to meet the demand for carers at the care homes. But we have to be mindful. There's a long-term demand for carers at care homes. That's why we need a long-term solution. That's why we have come up with this long-term measure, so that in the long haul, we can address the shortage of care workers at care homes. So first, the relaxation will be extended so that all care homes, those for the elderly and those for persons with disabilities, can apply. And we will have to streamline the application process. We are working on the details. Once that's finalized, we will make an announcement.
Sorry, the speaker is off mic. We'll try to see how further we can relax the rules. I think you understand that it only applies to privately run homes. In future, it will apply to all sorts of homes. In terms of the ratios, we'll consider how further we can relax the rules. Once they're decided, we will give you the details. As to the support to be given to the carers, I think you're right. The allowance will be increased from 2,400 to 3,000. It is welcomed by the relevant sector. As to who should be eligible to draw the subsidy, we need to draw a line because, after all, we are talking about public money. We're not going to change the criteria. We're going to maintain the existing eligibility rules. Next, in the 4th row, the lady in short sleeves.
TMHK, Professor Low, as the High Court has ruled that there is no power for you to invalidate the medical exemption certificates, and I understand that you've mentioned that there will be an official response later, but can you tell us briefly, like, what is your next step, and do you think the ruling has affected the government's anti-epidemic efforts? And the second question is, how would you ensure healthcare professionals to stay in the public sectors after training? Thank you.
Professor Low, please.
I'm aware that the court has given the ruling, but as you understand, I've been here explaining to you about the policy address, and we need to study the ruling together with our Department of Justice, and we will come up with an official response. At this point, I cannot give any comment on what action we will take, but suffice to say that as the Health Bureau, we have the duty to protect and safeguard the health of over 7 million people in Hong Kong. And our anti-COVID measures and all the policies and strategies are vital, and we have to ensure that we have enough legal support for undertaking all these anti-COVID strategies. We'll make sure that we have adequate protection for our citizens in Hong Kong. As far as getting the professionals to serve in the public sector, these healthcare professionals are very important resources to protect the health of the citizens in Hong Kong. And the government actually invests a lot into the education and training for these healthcare professionals. And we have to ensure that although those who have undergone the training, and eventually they will contribute in a certain way to especially our public healthcare system, which is actually the pillar for the majority of the citizens of Hong Kong. And that's why we've come up with this. I think in different healthcare professionals, there are certain mandates for service in the public sector in different ways. But we're trying to extend it and to ensure that our public healthcare system will be a sustainable system.
好，請問有冇勞工及福利？
Any questions concerning labor and welfare? Yes, the lady in the third row, please. Good afternoon. Mr. Sun, I think there isn't any KPI for alleviation of poverty except for the Strive and Rise program. Why not? And then the government has just been told that you have lost the court case concerning the exemption certificates. Do you think that you haven't thought through it before taking the action? I think we will focus on the other questions other than the exemption certificates. Mr. Sun, well, the government is concerned about poverty alleviation. In paragraph 95, I think the government has made it clear. It is our policy to be targeted. We have 110 KPIs, and the very first one is about poverty alleviation, and it is related to the Strive and Rise program. When you read through the policy address, well, in fact, if you have been following the issue, you know that poverty has to do with many different policies. One being public housing. The supply of public housing will have an impact on whether people can have their inadequate housing addressed. And in this policy address, you know that we have spent a lot of space and time on boosting public housing supply, and that will have a positive impact on poverty alleviation. So poverty hinges on a number of factors: education, healthcare, housing. If we have improvements on those fronts, it will also have a positive bearing on poverty alleviation. The next question, the gentleman on this side in the back row. Good afternoon. I'm from Commercial Radio. Professor Low. Well, there will be the Financial Leaders Summit in November. There will be special arrangements for the participants. For what about other inbound travelers? It is a matter of discrimination, providing differential treatment to others. And then it is said that there may be a relaxation of the mask requirement if the child inoculation rate reaches a satisfactory level. What is that? Regarding individual mega events and activities in Hong Kong, well, in fact, the chief executive has already, well, in fact, I have to emphasize that this is a policy address press briefing rather than a press briefing on COVID-19. But let me go back to the policy address itself, in which the CE talked about the path of fighting the epidemic. We have social distancing measures and other measures. You find them in paragraph 140. it is said that we will devise specific plans to ensure that major events and economic and large-scale activities in Hong Kong can be held smoothly. We want to be sure of the effects of our infection control measures. On the other hand, we'll be coming up with specific plans for mega or major events, but it doesn't mean that participants will not be covered by any infection control measures only, but rather there will be specific plans. Just now, our permanent secretary has answered the question in English. Maybe you want to get it in Chinese again. It shows that when we consider the plans, we look at the nature of the major events, the impact on Hong Kong, the number of participants, the choice of the venues, and then we will come up with specific plans. So it isn't a matter of treating people differently.
請啊。
Mr. Thomas Chen. For the Global Financial Summit, we have worked closely with the Hong Kong Monetary Authority. Our goal is to facilitate the holding of this event. We also want to now make it easier for those joining this event. The overarching principle is to keep the COVID risks manageable. So there will be testing. There will be designated hotels for those attending the summit. And there will be specified venues for these activities. I believe the Hong Kong Monetary Authority will make a more detailed announcement on this matter. And for the Health Bureau, when we look at major events, we focus on controlling the COVID risks. We talk to the organizers to work out effective ways to minimize the transmission risks while allowing the event to take place. Now, we also address the point about vaccination and the mask requirement. Vaccination is a very effective way to minimize deaths and critical cases. Different experts have expressed different opinions. Now, some argue we need a 90% vaccination rate, especially for young children and the elderly. Experience across the globe shows that in places like Europe, the US, or Singapore, where masks have already been dropped, some places are actually considering reintroducing mask wearing as a requirement. This goes to show that masks are also a crucial step to prevent infection. We stress the point that we want to avoid backtracking on our measures. In Hong Kong, look at the vaccination rate. The vaccination rate among the elderly and young children is still less than satisfactory. 28% of the elderly haven't had a jab. For those below the age of 3, the vaccination rate is just 18%. Let's bear in mind that this year, in the past 9 months, 9 children younger than 11 years old died of COVID or complications related to COVID. Contrast that with the seasonal flu. Each year, 2 to 3 children died of seasonal flu each year, but then we had 9 children dying of COVID or related complications over just 9 months, and that's an appalling figure. We want to protect the lives of children. COVID can also trigger complications in nervous system. It can also lead to long COVID. The vaccine pass is there to protect vulnerable groups, especially for those unvaccinated. If these vulnerable people enter high-risk venues, they are at risk. That is why the government insists on enforcing the vaccine pass. There are new measures. Over this weekend, we will be proactive by having different venues visit Wang Taixing, Kuntong, and Kuaicheng. We will visit the homes of seniors. We will visit public rental housing estates. We will visit those aged 70 and above, those unvaccinated. We will explain to them the importance of getting vaccinated. Next week, we will also make an official announcement. This announcement will be about the flu vaccination for 2022 to 23. We will extend the scope to secondary school students. There will be an outreach vaccination program provided for free so that secondary school students can go to a private doctor and get their flu shots. All these measures are meant to show the importance of having vaccines as a way to protect against respiratory infection diseases. Any more questions about labor and welfare? The lady over there. I'm from Hong Kong 01. A question for Mr. Chris Sun. The KPI says that by 2026, we want to lower the accident rate from 29.8% to 26.8%. How did you arrive at this KPI? Now, people die in industrial accidents. How did you arrive at this number? Now, how's the progress of the investigation into the Mirror concert and the tower crane case on Anderson Road? Just then, Professor Low, you said your job is to protect the lives of Hong Kong people. What's the risk for when you invalidate the vaccine exemption certificates? Will you be amending the legislation? We will now hear from Mr. Chris Sun. You're referring to KPI number 74. For industrial accidents, out of 1,000, every 1,000 workers, we look at the rate of those injured and those who died. The community pays a lot of attention to industrial accidents. So we have set ourselves a KPI so that we can do better. That's why you see KPI number 74. We want to reduce the industrial accident rate by at least 10% by 2026. Now, industrial accidents aren't something that the government can eradicate. We're trying to raise the maximum penalty for OSH offenses. We also want to do better in terms of inspections. We want to further cut down the industrial accident rate. There's a point unrelated to the policy address, but you just raised the question about the Mirror concert and the construction site on Anderson Road. For the Mirror concert investigation, we are close to the end of the investigation, so the details will be announced soon. As for the investigation for the work site on Anderson Road, it's still ongoing. We will look into this seriously. The speaker is not using a microphone. We are almost wrapping up the investigation, and once it's completed, we will make an announcement. Will Professor Low address the last question regarding vaccination? As for the judgment handed down by the court, we will look at the judgment before making a response. The government has a duty to safeguard the health of its people. Given COVID, vaccination is a key way to fight the disease. We need people to get vaccinated. The government will continue to push ahead with the vaccination drive. We will procure more advanced vaccines. We will do our best in that regard. We will also get more seniors and young children to get vaccinated. We will provide home vaccination services. We will also explain the importance of vaccination to seniors and parents of young children, so that we can boost the vaccination rates among those demographics further to protect them. Turning to the vaccine pass. Vaccine pass is a crucial part of our COVID policy, and the government will stick to it. That concludes the press briefing today. Thank you.